All right, well, thank you for coming at this late hour. I'm Dr. Michael Flyman from HRC Fertility in Encino, California. I just had a picture of our lovely clinic. Encino is a suburb of Los Angeles in the San Fernando Valley. It's very well located, centrally located. We have a Marriott hotel within walking distance, and it's actually a very big Israeli community in Encino, so you probably have relatives there. And there's Israeli restaurants, kosher, non-kosher. There's even a restaurant that's kosher food and non-kosher food in the same restaurant. Israeli restaurant. Only Israelis do that. As you see, as of course most of my friends and colleagues here, we have a state-of-the-art laboratory where we do all the IVF procedures, including ICSI, freezing embryos. We now have an in-house PGD lab that has the most modern what they call next generation sequencing for PGD. I had mentioned earlier in our talk, if you were there, that this is a picture of a day 5 embryo, a blastocyst. One of the gentlemen was concerned about, do embryos get damaged with PGD? And you can see here, this is a miracle right in front of your eyes. In a microscope is the whole pregnancy. Here is the part that becomes the embryo, and here is the surrounding area, as Dr. Doyle mentioned, the shell of the embryo becomes the placenta, and inside is the tiny little micro drop of fluid that will blow up 1 billion trillion times. Eventually, you have the baby, the gestational sac, and the amniotic fluid right here in the dish at day 5. And so when we do PGD, we take a few cells out from here, which is why we believe we're not damaging the embryo. It's virtually impossible to prove it now, because in the old days, when we're doing day 3 biopsies, they could say, well, if you biopsied embryo, a certain percentage didn't make it to day 5 more than the others. But now they're day 5 embryos, and all we can do is put them into the woman and see if they get pregnant. There's no way to really test if we're damaging them.
PGD is PGS? Is the
same thing, yes. I'm old school. There are a lot of questions, thank you for that question. So PGD is pre-implantation genetic diagnosis, because particularly in the earlier years, we were only testing for up to 9 chromosomes. We were doing day 3 biopsies. There was a larger source of error. So the ASRM, the American Society of Reproductive Medicine, made us change the title to PGS, pre-implantation genetic screening. It wasn't quite a diagnostic test, they said. But we really, it really is now, but this politically correct term PGS has replaced PGD. There's really quickly, PGD can be done for aneuploidy, which is mostly what we're talking about. That's looking for abnormal chromosomes to rule out Down syndrome and other similar conditions, and in the case of egg donors, to better pick the embryo most likely to implant, particularly if you're trying to avoid twins, or as we discussed, even if you're shooting for putting 2 embryos back, at least making most efficient use of selecting those single embryos for transfer. There really is no pregnancy advantage to aneuploidy screening in egg donors, and there's certainly a very little reduction in risk because you're already very low risk. I really can't remember in my career a Down syndrome baby coming from an egg donor. I mean, it can happen, but it's not very common. Single genes, particularly interest to the Jewish community. Of course, there are a whole host of, as they call them, for those Ashkenazi guys, the genes that such as Tay-Sachs, Gaucher disease, a whole list of diseases that are more common in the Ashkenazi population. Cystic fibrosis is common in all Caucasian population. There's a bunch of other genes that are not related to being Jewish, and so if a couple knows that they carry these genes, as we've talked about in some other sessions, we can find the embryos that carry the actual disease. In an egg donor situation, probably not too relevant, because in that situation you pick another egg donor. I mean, it would be silly to stick with an egg donor that you actually share a genetic trait with that's as bad as Tay-Sachs. Translocation, very quickly, is a rare condition where one parent carries a rearrangement of chromosomes that results in frequent miscarriages and the chance for Down syndrome baby. We can prevent that with PGD. So I saved this picture because it's the old thing. So this is what it looked like on day 3. You see we sucked out 1/8 of the embryo, and it possibly was doing damage. We had pretty good results in those days, but it was a potential source of damage. And the error that it also introduces, there's something called mosaicism, when there are two cells with different chromosomes in the embryo. So you can easily see if there's two cells that are Down syndrome and 6 are normal. You pull out the Down syndrome, you may call it Down syndrome, but it may have actually been a normal baby. So that error has been reduced by the blastocyst biopsy.
Are these sperm cells?
No, that's an 8-cell embryo.
No, downstream.
Yeah, those are sperm just attached to the old zona of the. They're just dead sperms in there. It's funny you should ask that, because they used to tell us to do ICSI on these embryos specifically to avoid having that DNA around. But that's the picture I got. I never really paid attention to it. But those are probably dead sperm attached to the zona, they call it the zona. So once the fertilization occurs, that zona hardens to prevent other sperm getting in. Good question. I'll get rid of the picture. The SART, Society of Assisted Reproductive Technology, runs 2 years behind in reporting, and I'm just showing you here our results, and particularly in relevance to you fellows. The donor rate pregnancy is quite excellent. Those are fresh transfers, and all frozen, FET, frozen embryo transfers, includes women over 35. So the ASRM does not, or SART, does not have us divide our frozen success rates by age. So that number 52 is a little lower, but it includes, there's a lot of bias in it, because it includes women of all different age groups. Also, in programs that still do fresh embryo transfers like ours, obviously there's going to be a bias of selection. We pick the best looking embryos to do the fresh transfers, and so the leftovers are often the ones used for the frozen transfers, or even in cases where couples come back for second child, there's going to be that selection bias. So you can never really compare this way the frozen transfer rate to the fresh. However, what I've shown you here is that with PGS tested embryos, the fresh and the frozen start to approach each other. And again, a little bit of the reason for the difference in success rates here versus here is a lot of these are single embryo transfers. And so there is a little bit of a bump in the success rate when you put two embryos in. We're not ever claiming it's totally equal, but the difference is small, and then of course it is at the price of twins. So in our view, these days, fresh and frozen PGS tested embryos are starting to approach each other in success rates, but there's still a slight advantage to fresh embryos.
The ages are for the egg donor, right?
No, these are ages these are all IVF cycles, all. So the only ones that are donors are these.
Right, so does it matter the age of the sperm donor?
That's a question that's controversial. It doesn't appear to affect success rate. There are questions as to whether it affects the outcome. To date, the evidence does not suggest that chromosome abnormalities are increased in men of, quote, older age, whatever that is. Would generally be considered over 45 to 50. So that's generally when they talk about older men. There are questions about other conditions like single gene mutations and other genetic problems might be more common in those gentlemen, but not the same thing as women with the aneuploidy. Still, of course, the overwhelming number of babies are healthy born from both men and women of either what we call advanced age. I have to be careful because again, this is just trying to. I do realize that there are couples and men who want to transfer from both partners. I understand that, but we, as doctors, try to remind you of the risk of twins and try to cut that down. So please forgive me for that. So what we're showing here is that, again, with single embryo transfer, the clinical pregnancy rate. So this is fresh donors with PGS testing. You can see a very handsome 68% pregnancy rate. The clinical pregnancy rate means we've seen the pregnancy on ultrasound with a heartbeat. So there's going to be a slight chance still for miscarriage, but probably under 10% there. And you can see Again, with 2 embryos, in this particular collection of patients, there was no difference putting 1 or 2 with PGS testing. So the reason in the old days we put in more embryos, we didn't know which embryos were normal. So it was a little bit of Russian roulette, throw in the embryos, come out with triplets. But that's no longer acceptable.
It sounds like that?
It's not acceptable,
Doctor?
that doing it
Yeah,
that
5
way.
minutes, okay? 5 minutes.
Okay, I'm almost done.
Sorry.
I'm almost done. I'm ready for questions. And then you can see the fresh without PGS was excellent, but again, there's a lot of double embryo transfers there. So the numbers keep moving around, but not that different when you do statistical analysis like that. So very quickly, some of the advantages of working with us is, as I said to you in my opening remarks, I'm very committed and devoted to helping Israeli people. Our clinic is well located, and we have multiple sites all over Southern California. So if you have a donor or a surrogate who lives in another town but in Southern California, we can monitor them in distant sites at no extra cost to you. Whereas when you work with clinics that have single sites and the donor or surrogate has to go to another clinic, you get charged for monitoring of that donor or surrogate, so that's something we can help you with. So now that I have about 3.5 minutes left, for the 3.5 of you that are here, if you have any questions, please ask away. Well, toda rabah, Shabbat Shalom. I hope I'll get to see you in Los